Hello, everybody, and welcome to our second workshop with the Annie Appleseed Project. We are really excited because we have a wonderful doctor who's part of the Annie Appleseed family joining us all the way from India. So I apologize to the West Coast people. For those of you who don't know me, my name is Joanna, and I am co-president of the Annie Appleseed Project. Before we get started, we have a few house rules. So I'm going to leave it over to our moderator, Jenny Bradley, who's going to jump on and just go over those real quick. And then we'll get started with our workshop with Mistletoe today. So Jenny, take it away.
Hey everybody, well, welcome to the Mistletoe, your natural ally in cancer care workshop presented by Dr. Zubin Marolia and of course hosted by our wonderful Annie Appleseed Project and friends. I'm your moderator, Jenny Bradley. I'm an Appleseed ambassador, a cancer thriver, and a certified cancer coach. And I have used mistletoe myself. I used it sub-Q injections and the IV mistletoe in my breast cancer journey. And I will be honest with you, it is truly the thing that I can point to as the number one thing that absolutely reduced my tumor pain. So be listening for the quality of life things that could happen with mistletoe today, as Dr. Zubin shares with us. I'm thankful for practitioners like Dr. Zubin and others across the USA and around the world who've been using mistletoe therapy clinically for decades, and they know how to guide patients like us based on scientific research and clinical experience that you're going to hear more about today. So thank you for joining us. You are in for a treat today for sure. So let's go over a few important guidelines today. So this is being recorded. It is going to be on social media and various platforms in the future as replays. So if you are staying on this Zoom call, you acknowledge and agree to being a part of this recording. Our medical disclaimer is please note that this workshop is for educational purposes only and does not provide medical advice. We encourage you to consult your trusted healthcare provider with any questions or concerns regarding your personal health or medical care. And to help ensure a smooth and respectful experience for everyone, please keep your microphone muted during the presentation. You are welcome to include your questions in the chat box or raise your hand, and we will do a Q&A with Dr. Zubin at the end of his presentation. If you have additional questions afterwards, I will be putting up his email address, and he said that you are welcome to email him as well. So with that, it is my honor to introduce you to Dr. Zubin Marolia. He is the founder of Enliven in India. He is a homeopath and certified practitioner of mistletoe therapy, the most researched and practiced alternative therapy for cancer. Dr. Marolia's vision is to expand his horizon in the field of integrative medicine, and it's led him to work alongside renowned doctors from across the globe, including Memorial Sloan Kettering and Johns Hopkins right here in the USA. His emotional connection with his patients and investment in their lives is the secret of his success in ensuring maximum patient welfare. Dr. Marolia has been studying and using mistletoe therapy with his patients for nearly 35 years. With that, please welcome Dr. Zubin Marolia.
Uh, Hello, everyone. Warm welcome to this presentation on mistletoe therapy, therapy that has been used for the welfare of cancer patients for over 105 years. And at the outset, I'd like to take the opportunity of conveying my thanks and gratitude to the Annie Appleseed Project, to my dear friends Julia, Joanna, Jenny, and John for being with me. And I've been coming to the Annie Appleseed Conference for the last 3 years. And the amount of warmth, love, and support that a person, not even a physician, that a person receives at the Annie Appleseed Conference is such a wonderful feeling. As I've mentioned in my earlier videos as well, it's a community where people come together to spread the warmth, the knowledge, and experience in cancer healing. So with that, I take you on a journey, my dear friends, today, a journey of 105 years of the most romantic plant in medical history. So let's begin. So, mistletoe has been very close to my heart for the last 34 years. And I would like to start with a small story today before I do the presentation. As I was starting my journey as a physician, as a naturopathic and a holistic physician, to understand patients and their journey of lives, I was seeing a few cancer patients in India about 3 decades ago. And what I observed most beautifully and most significantly was their quality of life under mistletoe therapy was really, really great. They used to have good appetite, lesser symptoms of cancer, better vitality, better mobility, better mood space, and a good feeling in general. And that was what really, really struck me in the year 1990, wherein I decided to embark upon my journey of learning about mistletoe. And since then, I've been using the mistletoe in different stages of cancer treatment for the last now 35 years. So the quality of life was the most significant factor that, as a physician, really struck me, and I said, I must work on the mistletoe. So, with this, we start today. Mistletoe, your natural ally in cancer care. My presentation today will be divided into certain parts. I will be sharing my journey, something about the mistletoe plant, the basis of mistletoe therapy, which is anthroposophical medicine, biorhythms in the body, the circadian rhythm, the seed and soil hypothesis, the holistic concept of cancer, salutogenesis, integrative oncology, and a case study. And in between my talk, as all of you may, most of you may know, I normally try to intersperse small stories in my presentation to make it more interesting. So we start. So as you all know, I'm a naturopathic and an integrative medicine physician practicing since 32 years. My specialization is in mistletoe and integrative oncology. 1989, I completed my graduation from the Medical University in Mumbai, India. 1991, after my initial interest in knowing about the quality of life in a cancer patient, I was invited to begin my training in mistletoe therapy and anthroposophy at the Lucas Clinic in Switzerland, which was the premier institute that invented and discovered and now also uses the mistletoe. 1994, after I came back in 1991, I wasn't satisfied with the training I had. So in 1994, I decided to write to the Lucas Clinic to work with eminent oncologists over there, and I gained clinical experience in mistletoe therapy. In 2009, a long gap of almost 15 years of practicing mistletoe, I learned about the Integrative Medicine Center at Memorial Sloan Kettering Cancer Center in New York, and I was invited to share my experiences in integrative medicine from the eastern parts of the world. So each time that I come to the West, to the United States, and to Europe, I always try to bring some nuggets of understanding from the Eastern philosophies of healing. In 2013, I was invited to present my work at Johns Hopkins University School of Medicine. In 2012 to 2018, I was invited for delivering 4 consecutive lectures at one of the most beautiful series of integrative medicine meetings in Germany by Helixor. These were called as the integrated medicine meetings, and they included and had a beautiful participation of all therapists, patients from all over the world in a beautiful part of Germany. In 2014, I completed my fellowship in integrative oncology from the Filder Clinic, Germany. In 2016, I was in Vienna for advanced training in cancer management. And in 2019, I presented my work at one of the largest conferences promoting alternative and complementary healing and cancer care, that is the Truth About Cancer series. And I've been coming to the Annie Appleseed conference to share the love, the warmth, the support and my knowledge and experience in mistletoe therapy for the last 3 years. A little bit, I wanted to share my journey, so I said, let me put this slide. Why mistletoe therapy even today, as oncology advances at such a rapid pace with advanced medical diagnostics, with advanced techniques in cancer detection, with tumor markers? Why the mistletoe plant? And that is because, number one, improved quality of life in cancer patients, relief to caregivers, a positive impact on the immune system in a stepwise manner, in a manner that optimizes the immune system. As research in cancer progresses at a rapid rate, we also want to know more about ancient wisdom, which must also be given importance. From mythology to medicine, mistletoe has come a long way. Last but not the least, mistletoe therapy stands for hope. If we were to study this slide on the use of complementary medicine in cancer patients, you can see that nearly 54% of patients today want complementary therapies to be a part of their cancer journey. And the most common used methods today, as you've seen in the slides, we have the mistletoe extract, which is now the number one cancer complementary based plant medicine today. We have mistletoe, vitamins, trace elements, supplements, enzyme, tea, and off-label drugs. In the data that I collected with my research team here in India on the types of cancers that we've been using the mistletoe most commonly include breast, colon, ovary, kidney, prostate, stomach, some pancreatic cancers, lymphomas, glioblastoma, and leukemias. But on the right side of the slide is a very interesting wheel, and I want you to look at the wheel very carefully, my dear friends. Firstly, when I began the journey of treating cancer patients with an integrative and a holistic approach, the percentage of patients that seeked mistletoe and other complementary therapies was just 4 to 6%. And as the journey of cancer patients, as the knowledge and experience of complementary therapies gained momentum in the last almost about 15-20 years, I began seeing patients more and more in stage 1. So here we have that even today, stage 1 patient, there are 23% of patients that come in stage 1, about 8% in stage 2, about 6% in stage 3, but the major chunks remain 63% or nearly 2/3 come in stage 4 for palliative care with mistletoe therapy. So the history of mistletoe, very interesting slide. Again, according to a custom, and I know that we've just had Christmas recently, so let's go to some interesting historical facts about mistletoe. According to custom, if a woman is caught standing under the mistletoe, a man may kiss her. For centuries, mistletoe has been considered a plant that increases life and fertility. By the 17th century, people believed a kiss beneath it could mend a broken heart. The ancient Druids in Celtic cultures believed mistletoe to be a sacred plant, and it was used in many of their rituals. In fact, the mistletoe was hung over doorways to ward off evil spirits during winter solstice activities. Mistletoe branches are traditionally hung over doorways, as we all know, at Christmas times for peace and good luck. Mistletoe is considered a symbol of life, as we all know, because even when its host is leafless, it's evergreen and bears fruit in winter. The word mistletoe is thought to stem from the Saxon mistel, tan, meaning different twig. Again, in ancient Scandinavia, mistletoe was known to be a plant of peace. Mistletoe has been used historically in medicine for over about 100 years or more than 100 years for treating various conditions like arthritis, high blood pressure, epilepsy, and infertility. So let's understand the significance and the similarities of the mistletoe with cancer. As we all know, the mistletoe comes from Viscum album. It's a half parasitic plant belonging to the family Loranthaceae. And as you know, it's a half parasitic plant. It grows on host trees like the oak, pine, fir, elm, and others. An evergreen shrub growing on branches of deciduous trees. A geometric growth form that becomes spherical on undamaged growths. Leaves are leathery, opposite, and yellow-green in color. Flowers are inconspicuous, yellowish green, and insect pollinated. The fruit is a white or yellow berry that contains one or several seeds. Stems, brittle with 2 degrees branches, and parasitism, a parasitic plant that connects to the host tree through the hostorium. Doesn't kill the host, but can weaken it. And nutrition, it is able to conduct its own photosynthesis. So here is the picture of the host tree, my dear friends, and here you see the bunches of the mistletoe. You see that? All the bunches of the mistletoe growing on the oak tree. The doctrine of signatures dating from the time of Dioscorides and Galen states that herbs resembling various parts of the body can be used by herbalists to treat ailments of those body parts. Paracelsus developed the concept, writing that nature marks each growth according to its curative benefit. So the similarity of mistletoe, the first is autonomy. It emancipates itself from the normal biological rhythms in nature to which other plants are subjected and thereby asserts its autonomy just like a malignant tumor. Parasitic nature, it's a half parasitic plant. The branches of the host tree which are seized by the mistletoe are sustained longer than the other branches. Indefinite growth. So as you see in a cancer, when the cancer cells multiply and there is unlimited proliferation of cancer cells, similarly, the mistletoe plant grows in all directions. The leaves, the stems, the berries, just like a tumor. So when you have a cancer that is developing in the body, it grows in all directions. It metastasizes to all parts of the body. And the mistletoe plant, the bunches that you see on the host tree also grows in different directions. The stalks and leaves grow in different directions, and the upper and the lower surfaces of the leaves are undifferentiated, just like an undifferentiated carcinoma. The healing property. It actually grows in those places on the host tree where there are proliferative growths appear, and they promote a sort of healing process. In fact, it actually helps to devour the tumor-like protuberances which occur on the host tree on which it grows, as you can see in this line. The bulbous growth on the whole, just like a tumor, how it forms a nodule, how it forms a lump. And just like a cancer and the metastasis, the primary tumor, and when it metastasizes to different parts of the human body, here you find the mistletoe growing on the host tree, and there are bunches in different parts of the host tree resembling a widespread metastasis. The comparative gestures of cancer and mistletoe. In cancer, we have a displaced feature, freedom in the wrong place, and as we all know, undirected growth of cells. Mistletoe, also there is an incongruosity of freedom in areas that are usually well bounded. abundant life forces in cancer, abundant life forces in the mistletoe. Cancer is chaotic, whereas mistletoe is more structured. Cancer is fast growing, whereas this is slow growing. Parasitic qualities can destroy the host, as we all know when cancer occurs. This is a hemiparasite, doesn't destroy its host. So there are various features between the disease, cancer, and the mistletoe, the plant. The ecological importance of the mistletoe. It is also ecologically important because it is a keystone species. A keystone species are organisms that have a disproportionately pervasive influence over their community. In fact, very interestingly, studies have shown that forests with moderate amount of mistletoe are much more biodiverse and ecologically healthy. A study of mistletoes in the savanna of Zimbabwe found that mistletoe leaf litter pumps additional nitrogen, phosphorus, and other nutrients into the soil, influencing the diversity. So the whole aspect of the mistletoe and its use in cancer treatment goes back 108 years in the year 1917 in a small village on the outskirts of Basel City. And there were two physicians at that time who found the properties of the mistletoe can be very effective in cancer treatment. This was Rudolf Steiner and Ita Wegman. And they recognized the importance of applying mistletoe in cancer treatment. One can ascend to the higher development only by bringing rhythm and repetition into one's life. Rhythm holds sway in all nature. Real medicine can only exist when it penetrates into a knowledge that embraces the human being in respect to body, soul, and spirit. Very beautiful words by Rudolf Steiner. And here comes a very, very important aspect of rhythm in healing and how we all need to be rhythmically very, very strong. So my next few slides will be on understanding the rhythmical balance in the body. So anthroposophic medicine, a key perspective. Cancer is a result of decades of long processes of disruption in the rhythmical balance in multiple body systems, mainly metabolism, nervous system, and the immune system, as well as the patient's emotions and sense of spiritual purpose. The integrative oncology physician's role is to restore this sense of rhythm and coherence within the body's regulatory systems. Rhythm and balance are very, very necessary for healing. Cancer is regarded first as a loss of biorhythm, both within the body and between the body and its surrounding environment. This rhythm we are discussing in medical language, as we all know, is the circadian rhythm. Every individual cell maintains a particular rhythm, and that the microbiome in our response to any therapy is circadian rhythm dependent. And mistletoe's primary role is to restore this rhythm in the body, in the metabolic level, in the nervous system, and at the cellular level. Disrupted circadian rhythmicity has been a prominent feature of modern society since the invention of artificial light sources. Just to give you a small example, 18 to 20% of workers in the USA and Europe are involved in night or rotating shift work, making them vulnerable to multiple rhythm disorders, including cancer, mainly because of the disruption of sleep. Studies suggest that night shift work or chronic jet lag increases the risk of the incidence and the development of the most common cancer types: breast, lung, prostate, colorectal, and skin cancers. Based on this evidence, the International Agency for Research on Cancer, IARC, classified shift work that involves circadian disruption as potentially carcinogenic to humans in 2007 and again in 2019. And here it's very important to understand, even though, of course, your work involves shift duty, you have airline crew who are doing shift duties, you lose your sleep, but it's always very, very important to understand, to get that rhythm back in whatever form as possible, to regularize and have a regulatory balance in your life. Restoring natural rhythm. A full case history is important to identify healthy rhythmical patterns in patients. Biographical inquiry, lifestyle questions, and observational medical examination data is taken. Bedtime routines, average amount of sleep patterns, appetite, bowel patterns, response to seasonal weather changes are noted. And in the active cancering process that I have found in my patients over the last 30 years is zero rhythm, sleep deprivation, artificial light exposure, improper diet timings, no rest, and constant stress. Inflammation and mistletoe therapy. In all stages of cancer treatment, it is very important to re-establish the healthy inflammatory rhythm. This becomes the core task of mistletoe. The heat and fever response to mistletoe injections is actually the induction and the re-establishment of the healthy warmth cycle. It can be considered a warming therapy. In short, mistletoe therapy helps the immune system remember how to cycle through times of heightened inflammation and then progress through optimal resolution. And here comes a very, very important, pertinent point wherein in the history of a cancer patient, we always ask if they have developed the normal fevers in their life. The childhood fevers, high fevers that we see in measles, in mumps, in chickenpox, etc. I always make it a point, and mostly about 60 to 70% of patients mention that they have been well all their lives, never had a fever, a simple fever, which is so very important to have a regulatory optimization of the immune system. And that brings us to another very interesting topic, which is my latest research on fevers and in cancer. So right now we are doing a lot of research on induction of high fevers in cancer patients at the Hufeland Clinic in Germany, wherein I work with a doctor over there, wherein many stage 3 and stage 4 patients, we induce fevers by injecting certain bacterial toxins. Now, this particular research in fever therapy is nothing new, my dear friends. It comes from Dr. William Cooley, and the therapy is called Cooley's toxins. So that's, again, with mistletoe is my latest interest in understanding the development and the induction of fevers in cancer patients. So we are very much in the throngs of having a small study done. Anti-inflammatory activity. The viscum album extracts exhibit their action as a phytocomplex wherein they work with the extracellular signal-regulated enzymes in addition to viscotoxins and viscolectins. They also contain numerous other constituents that can participate in the main property antioxidant, anti-inflammatory, and anti-stress activity, which supports the overall actions in restoring or maintaining homeostasis. The metabolome's components, especially the identification of novel active elements that differ greatly from microproteins, should get special attention. Cancer is a unique disease. We all know it's not a bacterium or a virus or a fungus, an infection that we can kill off. Cancer cells are our own cells. In the past few decades, we have adopted a war or a fight mentality towards treating cancer. Even today, as we all know, most therapies aim at destroying the cancer cells with strong drugs being administered to patients. So we have surgery, chemotherapy, radiotherapy, immune checkpoint inhibitors, target therapies that only look at attacking the cancer, attack the cancer. This war attitude on cancer has become actually a war on ourselves. And we have disregarded the power of the body, the soul, and the spirit to assist in our healing. And that has been part of my work as an integrative medicine physician over the last 30 years to understand the entire cancer journey and to understand exactly how the body can be made powerful in mind, body, and spirit in the healing of cancer. Another very important aspect is the terrain in the body. Stephen Paget observed that certain tumors tended to metastasize to only certain organs. He believed that there must be a certain soil where these tumors preferred to grow. When a plant goes to seed, its seeds are carried in all directions, but they can live and grow only if they fall on congenial soil. He further adds that each cancer's behavior and progression dependent on the condition of the whole person, the soil, and not solely on the aberrant cells. Today, cancer researchers are revisiting the Paget's theory, referring to Paget's seed cells as the progenitor cells or the metastatic clones, and his soil concept, as we all know, is now known as the tumor microenvironment. So it is the whole person that develops the cancer. It's always the whole person, my dear friends. And it's very, very important for every person, every physician that is dealing with cancer patients to understand the whole person. We must look at health in terms of multiple whole body layers which are part of a complex ecosystem, the soil. Many centuries ago, pathologist Rudolf Virchow mentioned germs seek their natural habitat, diseased tissue, rather than being the cause of dead tissue. And in the soil components of health, in my 3 decades of medical practice, we have certain pathways that we use in the holistic evaluation of every patient. Genetics, biorhythms, microbiome, immune function, metabolism, and mind and emotions. So it's very, very important to understand the whole person having the cancer. And in this holistic concept, there is, and we have to understand this concept in a few lines, there is a dynamic equilibrium that is normally maintained in the organism between the ever-present tendency of the cells to multiply and differentiate and the controlling mechanism of the whole organism, which maintains itself by limiting this multiplication of cells within normal growth. It is when this equilibrium breaks down that cancer develops. Smithers had suggested the presence of form-giving processes in the healthy organism, which normally maintains a dynamic equilibrium. So there is an equilibrium between the ever-present tendency of the cell to multiply and the controlling mechanism of the organism. There are form-giving processes which are the defense mechanisms or the immune system in our body. A cancer cure cannot be affected by local regional measures or local measures alone. As we all know, too much importance is given to the prevailing loco-regional concept to achieve a total destruction of all tumor cells. The malignant tumor has been given excessive one-sided attention, and its opposite number, the human organism with its defensive powers, has been totally neglected. And over here, I'd like to share a story of a patient that I saw of advanced ovarian cancer about 10, 12 years ago. I have presented her history for many, many a times. So she comes to me with all her reports, and she has developed widespread pelvic metastasis post the recurrence of ovarian cancer the third time. And all her pelvic lymph nodes are extremely enlarged, which is blocking the circulation from her lower limbs to the body. So she has a huge swelling of her right lower limb, which is preventing her from doing her normal activities, from going to work, from maybe working for the family. And as you all know, I've been in the field of holistic medicine. And my favorite question, which I always ask my patients, is tell me your story. And her husband is sitting next to her, and her son is next to her, and they want to show me the reports and the histopathology of the reports and the MRI and the target therapy she's taken, and she's sitting on one side extremely quiet. And I ask her, I said, okay, I will look at the report, but I want to still listen to your story the first time. Tell me your story. So she says, Dr. Marolia, I have come to you with a lot of hope, and I want you to give me a medicine so that I can work. These were her words, her first words, her calling. Give me some medicine, give me mistletoe so that I can go back to work. With this huge leg, I can't walk, I cannot commute to my bank work. She doesn't talk of removing the cancer. She doesn't talk of shrink my cancer or destroy my cancer cells. She talks of what she feels and she wants to start her work. And I ask her, can you tell me why do you want to work even now? Because you are now supported by your husband and your son. So she says that my husband has lost his job a year ago, and we are facing certain financial irregularities, and we are facing some difficult times in our family. And I want to contribute because I've always been working since I was in college. I've always been working and working and working, coming from a poor financial background. A lot of struggle in life, financial struggle in life, struggle. And we understand her whole story. And of course, I give some time to looking at the reports, but I am clear in my mind as to the direction as an integrated medicine physician to understand her life and what the cancer means to her and what life means to her. So we start her on mistletoe therapy. Her hemoglobin improves, her quality of life improves. We are able to arrest the malignancy for a few years, and she starts to work after 8 months of mistletoe therapy, wherein all her lab parameters become stable. And no chemotherapy was advised post my consultation. So here it's very, very important, and all physicians have to make it a point to understand what the patient actually wants. I'll tell you another story once we go ahead in the presentation. The true meaning of holistic, to take the body, the organism, its anatomy, its physiology as a whole. This will help us understand when you have cancer and when cancer has you. We need to focus less on what you have and more on what you are. This is a very, very interesting slide, my dear friends. Do not get so taken up by the cancerous condition that you forget the most essential part of your treatment, and that is the general condition of the patient. General condition of the patient. What do you actually mean by that? What would physicians do 50, 60 years ago when a patient used to come to a doctor? They used to do an examination, a general examination of the general condition of the patient. You may ask your parents, your father, your mother, your grandparents. Conventional doctors at that time, 50, 60 years ago, would examine you in a complete holistic whole. For example, they would look at your eyes, conjunctiva, they would look at your palms, back of your palm, this part of your palm, they would look at your neck, your tongue, your teeth, your lymph nodes, your chest, your liver, your spleen, make you walk. Make you walk inside the clinic, make you walk outside the clinic. Many times in my practice, because the area is restricted, I tell a patient, come with me, let's go for a walk. And we walk with our patients a few paces, trying to understand their story. And then we come back to my chamber. And that is what is called as the general condition of the patient. So that when a patient walks in, you are immediately able to make out by the pace of their walk how much is the vitality of the body being preserved. And normally we all know about the IQ and the EQ. I have what's called as the VQ. The VQ stands for the vitality quotient of the body. What is the vitality quotient of the body? And there are certain parameters which we use to understand that in our practice here in India. And of course, the patients I see around the world. So, unfortunately, because the advancement in medicine technologically has advanced so many times ahead, physicians have forgotten this art of general examination, of touching their patients, of putting a hand on their back, of patting their patients. Even today, I have a patient, a journalist who comes to me with ovarian cancer from a super specialty hospital. And when she first came to me, this was about 4 years ago, another story. 4 years ago, she comes to me with recurrent ovarian cancer for mistletoe therapy and extremely weak, anemic, compromised immune system, an immune system that's suppressed. And I do my general examination and we take her out for a walk. I want to know how many paces she can walk. I bring her back to my clinic. We sit with her. We do a full 1.5 hour, 2 hour analysis. And then I examine her the way that I mentioned to you, my dear friend. Then I examine her abdomen. And then I call her back to the chair and she is smiling. She's saying, may I know why you're smiling? So she says, you're the first doctor in 8 months that has examined my abdomen, that has actually touched my abdomen for 8 months. I've only been understood by my reports. And this is what I teach at the medical university here in India. Every Tuesday, we have interns, registrars, house physicians of doctors who are going to now go into society. So that was another story I wanted to share. We go ahead. Again, we go to the holistic aspect of cancer treatment. In one aspect over here, my dear friends, if you see on the right-hand side, you see the conventional therapies, surgery, radiotherapy, chemotherapy, and the hormonal agents. And of course, the main conventional battery of drugs, wherein they want direct cancer inhibition, wherein you intervene in the pathogenesis of cancer. That is what your conventional therapies are doing. But on the left-hand side, you see all holistic therapies. You see diet, exercise, lifestyle, psycho-oncology, mistletoe, and other natural remedies. And here in is what you are doing is stimulation of the immune defense of the body, wherein you are treating the host, restoring wellness and health. Restoring wellness and health, or what I call as the vitality quotient of a patient. So here in this slide, you have a balance. And that vitality quotient of the vitality is described as salutogenesis. It's a term coined by Antonovsky, and the term describes an approach focusing on factors that support human health and well-being rather than on factors that cause disease. And you have to understand the sense of coherence of a patient, which is the ability to comprehend the whole of a stressful situation, and the capacity to use the resources available is called sense of coherence. The SOC reflects a person's view of life and capacity to respond to stressful situations. It's a global orientation to view life as structured, manageable, and meaningful or coherent. So again, a concept over here of the pathogenesis concept and the salutogenic concept. The whole person ecosystem. As we all know, Western medicine and super specialization has led to compartmentalization of the body, whereas the body's organs are actually all intricately linked and interdependent. So now we come to the aspect of integrative oncology, wherein you want to know exactly in integrative oncology as to what you are trying to integrate and why you are trying to integrate. Keeping in mind, it is always the whole person. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. It aims to optimize health, quality of life, clinical outcomes across the cancer care continuum to empower people to prevent cancer and become active participants in cancer treatments. And mistletoe over here becomes a very, very important pillar in integrative oncology. Again, you have the conventional therapies, the patient in the center, and an integration over here, as you see, an integration with complementary therapies. This is another aspect wherein we are trying to understand research versus clinical evidence. Mistletoe therapy has stood its ground on many fronts. There are 2,000 scientific publications, 130 clinical studies, 40 prospective randomized clinical trials. And of course, testaments of multiple patients benefiting from treatment along the course of 100 years. So with that brief introduction about mistletoe therapy and the plant, we start with a case, and the last part of the presentation will basically be a case that I will be sharing with you, a case of ovarian cancer in the 4th stage. When the patient had seen me, she had some abdominal distension, some acid dyspepsia, and a rumbling sensation in the abdomen. When we examined her abdomen, we found that there was a mass felt in the left iliac fossa, which was mobile, firm, and non-tender. She had a pervaginal examination, which revealed a cystocele, and she already had supraclavicular lymph nodes in her neck when we had started the treatment. So this was in February 2016. She had bilateral supraclavicular lymph nodes, and the ultrasound and the CT scan showed multiple masses, ovarian masses, which were solid and cystic, and they were abutting the iliac vessels. They were enlarged calcified lymph nodes, mesenteric, iliac, and para-aortic. And she was a case of metastatic papillary adenocarcinoma, and a CA1 to 5 was 915. Her weight was 65 and a BP was normal. And she had a right supraclavicular nodal mass. Now over here, my dear friends, February 2016 is the date that she consulted me. As we go ahead in the history, she had a good general condition, and we started mistletoe injection, which is the Mali, the M mistletoe, which is the mistletoe plant growing on the apple tree. She had a good skin reaction. In May 2016, she had some diarrhea at that time with urgency for urine, and a fear that the cancer may have increased. Though her marker levels fell down, she was counseled, trying to understand her symptoms, and she was given a certain homeopathic medicine. Mistletoe continues, and general condition better. She is feeling positive. September 2016, about 6 months from a diagnosis, she had a history, or she received some news that a family member had expired. And there was certain depression that she was facing. She was asking questions as to, will I survive now? Do I have the cancer? What will happen to my family? So we had given her the Mali mistletoe from the apple tree, the second series, alternate days, and she felt better. Sadness and depression were much better because, as I've mentioned, mistletoe also plays an important role in mood stabilization. And she celebrated her birthday with dancing and singing. In November, she had a slight progression of ascites, though her general condition, etc., was very, very good. So we took her marker levels again. They were a bit high again, and we began her on an intravenous infusion of mistletoe therapy. As you all know, mistletoe is given in basically four formats. Number one, and primary format always and always, is subcutaneous mistletoe therapy. Most of the research and the prime mode of application is the subcutaneous route of giving mistletoe therapy. And when we find that there is a certain stabilization with the subcutaneous route, and we find there is progression of metastasis, we give IV mistletoe. I have seen a trend wherein people have been given IV mistletoe at the very beginning of treatment, which is not the European standard of care in mistletoe therapy. And this is a very, very important point in many of my numerous medical seminars and programs that I hold around the world, wherein we explain the standard of care is always to start with subcutaneous route of mistletoe therapy. So March 2017, so as we go ahead and ahead. So 1 year, her marker levels 700. She comes to my clinic and we change the mistletoe type because of the progression to the peony mistletoe, the pine tree mistletoe, depending on the host tree on which mistletoe grows. And she receives her IV therapy once a month. She is stable. May 2017, she has developed an ascites and she receives a subcute mistletoe. And we also call in the surgeon in our team because we want to reduce the ascites. So we ask the surgeon to do an intraperitoneal installation of mistletoe. And my dear friends, at that time, if you see in this particular patient, she has decided to take no conventional therapies, no surgery, no chemotherapy. So we finished 1 year, ascites, 2018, March, 2 years. Patient is feeling better. IV mistletoe, 500 milligrams that she has been taking. Again, she needs ascitic tapping. We do the tapping. She's still stable, attends office, August 2018. She has an ascites that keeps on recurring, which we manage with intraperitoneal mistletoe therapy. From November 2018, we start her on high dose IV mistletoe therapy and overall general sense of well-being and feels energetic. This was the follow-up of 18. In 2019, she continues the mistletoe therapy. In 2020, 21, 22, she continues the mistletoe. She continues working for 8 years. And in 2023, unfortunately, due to certain events in her family, she develops a lung metastasis. And sadly, we lost her in February 2023. But she was on mistletoe for 8 years with an excellent quality of life. On the Truth About Cancer series video, she's called as the Biscuit Lady because she used to come to my clinic and always get me a pack of biscuits around the tea time. Second case of ovarian cancer, again diagnosed with ovarian cancer stage 3C. This patient underwent surgery, a panhysterectomy, and a salpingo oophorectomy. And from October 17 till Jan 18, she receives her normal conventional chemotherapy. So she comes in June 18, abdominal discomfort. CA125 at that time was normal, but she underwent all her conventional therapy, but she has come for prophylaxis. And we start Helixol, which is again mistletoe, Mali, the apple tree, and she has a good skin reaction. October 18, marker levels increase gradually, but good local reaction. She feels well. And in 2019, she develops a slight recurrence, but her energy level and her body stability is maintained. We increase the mistletoe type to series 2. In Jan 19, she has a very low vitality. She feels fatigued. When she wakes up in the morning, she is not fresh. Her sleep patterns, her biological rhythms are disrupted. So we start her on IV mistletoe, wherein we dissolve 100 milligrams of mistletoe in 250 ml of normal saline, and she has an allergic reaction, abdominal rashes, a very good sign, a good skin reaction. 1 week interval, and we resume sub-Q mistletoe, overall better and calmer. March 2019, she has an abdominal pain, again a slight recurrence that she has, which indicates, the CT scan indicates that she's developed peritoneal metastasis and mesenteric deposits. So the oncology team of a hospital decide to operate on her. So we give her the mistletoe before the surgery. Now herein, again, there's a very interesting fact which many people do not know is surgery and any surgical procedure in a cancer patient leads to a surgical suppression of NK cell activity. This is a published PubMed article. So what we do is most of my patients that come to me and the surgery is planned, so we are in touch with the oncology team. So we are very fortunate now to have a huge oncology team which is conducted and which comprises of myself as the head, and we have 2 oncosurgeons, oncophysicians, an orthopedic doctor, a pediatrician, 2 physical therapists, and a yoga therapist. So it's a very, very good integrative joint effort wherein the patient is not lost. And most importantly, the patient is not afraid and ashamed to tell his oncologist that he is under Dr. Zubin Marolia's care with mistletoe therapy. I tell my patients, feel proud, feel strong, and beat your chest, tell your oncologist you are on mistletoe therapy because you are optimizing the immune system. That's very important. And that is the confidence you give when you work in an integrative manner. So we are fortunate that we have a whole team at one of the super specialty hospitals here in Mumbai, in India. And we regularly coordinate, we regularly have discussions as to the well-being of our patients. So coming back to this case. So she undergoes surgery. I'm going to take you back 1 slide. So she undergoes surgery. She takes the mistletoe jab 48 hours prior to surgery to support her immune system so that the surgical suppression of NK cells does not happen. And then she takes her mistletoe series 4. She's again stable. I go and see her in the hospital, and then she asks me the first question, Dr. Marolia, when do I start my mistletoe? I underwent a huge surgery. I said, we will give you 7 days time and then you can restart your mistletoe. And she feels the lack of mistletoe even for those initial few weeks that she had to go in for surgery and we had to stop therapy. So she undergoes surgery. I see her in the hospital and a PET scan is done. No evidence of metabolically active disease. She receives the chemotherapy post-surgery. Stable. September 2019. And you see over here, December 19, slight abdominal pain, but overall she is better. She started on target therapies like olaparib, and she continues her IV mistletoe and sub-Q as well. Subsequently, in Jan 2020, we put her only on IV mistletoe. She comes to the clinic, takes her Mali, 250 milligrams of IV mistletoe. Marker levels are normal. Warmth reaction achieved. Stable, stable, stable. General sense of well-being and fatigue is getting better. October 2020, and then she's 21, 22. She is stable, stable, stable. She stops her olaparib tablet. She stops her target therapy in 2021, continues her IV mistletoe, living a good quality of life. And here you see her at my clinic. Don't just treat the person, heal the whole person. Very important. The whole person ecosystem has to be understood. The whole life journey of a cancer patient has to be understood. I come to the end of my presentation. I thank you. I thank the Annie Appleseed Project once again for allowing me to share my experience and knowledge in mistletoe therapy. And the floor is open for the Q&A. Jenny, Joanna, you can take over.
Thank you so much, Dr. Marolia. I know every time you speak about mistletoe, there's always something new to learn. So thank you for always sharing your insight. I just want to jump in real quick before we start our Q&A and let everybody know that Dr. Marolia is going to be on our mistletoe and other herbs panel at the Annie Appleseed Conference, which is going to be coming up February 26th to 28th in West Palm Beach, Florida. We do have a few seats left. If you'd like to join us and meet Dr. Marolia in person, we have a discount code HEALTHY, which Jenny just put in the chat. So before we sell out of our seats and you want to meet him, please do so. We'll also be having more information on our website about Dr. Marolia and his Truth About Cancer series. So any information regarding him and contact information as well, you can find it on our website under the About Us section. Dr. Marolia is also one of our global partners and our medical global director. So under his tab, you'll find some videos about him. And now I will leave it to Jenny to moderate some comments. So take it away, Jenny.
Thank you, Joanna. Okay, we have some questions in the chat and I have some follow-up questions as well. So I'm going to start over here in the chat. Can you please speak about reactions and what they mean? Also, why is mistletoe always given in the morning, or is it always given in the morning? And that is from Lisa.
So mistletoe is given in the morning so that the physiological body temperature rise, and the body temperature rise what is called as a very, very gradual and mild hypothermia through which mistletoe works in stimulating and optimizing the immune system. So it's given in the morning so that it coincides with the physiological rise in body temperature.
Thank you. All right. Susan has the question, how do you know when to increase the dose and how often to inject it?
Well, I think that depends on the clinical acumen of the physician. Wherein you see a patient again, if you've seen my presentation very carefully, both these presentations, I did not pay much importance to the tumor markers. You see the tumor markers going up, down, up, down, up, down. You have to go to the clinical condition of the patient. Physicians, and I'm very clear when I teach at the medical university, I am very, very clear. It's always the clinical condition of the patient, which means the vitality quotient of the patient. How do you feel energetic? How is your appetite? Do you walk? Are you stable? Do you sleep well? And most importantly, of course, that another, the cancer psyche, Joanna and Jenny is another 1.5 hour presentation. Maybe we can do that a bit later. The cancer psyche, are you loved by your beloved ones? Mind, body, and spirit. That is what doctors were meant to do 50 years ago, 40 years ago, 30 years ago, 20 years ago, and even today. They were not meant to just see the reports. They were always meant to be on the journey of a patient, more so a cancer patient. So you look at the condition of the patient, the appetite, thirst, and then you decide. Of course, you see the progression of the tumor, you see the PET scan, you see the tumor markers, but you always look at the condition of the patient, and then you take a decision on whether to give the subcutaneous dosage every day. Sometimes we even give sub-Q every day, or we switch over to IV. So that's depending on the individual patient and the nature of the cancer.
So kind of going on that same train of thought, are there any specific contraindications for mistletoe therapy?
No, I've not seen any potent and allergic reactions to mistletoe. Only in patients with uh, a kind of an underlying autoimmune disorder, then you have to be careful with the mistletoe and the dose that you give. So if you have an autoimmune disease along with the cancer, then you have to start with the mistletoe at a very low dosage. Otherwise, we start with series one and then we go higher and higher.
So, with that, is mistletoe appropriate for someone undergoing immunotherapy, even integrative and natural only immunotherapy?
Yeah, well, immunotherapy has been the latest advance in cancer treatment. I've seen many patients in which the tumors have completely disappeared with immunotherapy. I have a patient right now, an elderly lady with breast cancer with a lump, taken palbociclib. The entire tumor disappeared. She was under my care with mistletoe. Unfortunately, it recurred in about 8, 9 months' time. So, mistletoe plays a very important balancing role when you take immunotherapy. Now, what happens in immunotherapy is that many a times the immune system is stimulated way more than it's required. The immune system, we have to understand, is a stepwise layer of cells, right from the bone marrow to the peripheral circulating cells. So you have the T lymphocytes, the B lymphocytes, the macrophages, eosinophils, etc. So when you are giving a very strong immunotherapeutic drug, sometimes and in certain percentage of cases, you see what's called as a hyperimmune response, wherein the immune system goes to the other extreme. And you have side effects like diarrhea, hepatotoxicity, polymyalgia rheumatica, wherein joints and muscles ache, and fatigue. So mistletoe helps to allay those side effects and balances the immune system. Much of the work with immune checkpoint inhibitors and mistletoe therapy has been done by my colleague, Dr. Friedemann Schad from Havel Hospital in Germany. I met him, Joanna and Jenny, in Rio de Janeiro at a conference wherein we were sharing our notes. And so we use mistletoe with target therapies and immunotherapies as well to balance out the immune system.
So, you mentioned that you can have an overreactive immune response as well. Can you talk a little bit about how you time certain things like scans and imaging as it relates to when someone is doing mistletoe therapy?
So, when you see a cancer patient the first time and we do a detailed analysis of the history of the tumor, the staging of the cancer, what stage it is, and the differentiation of the tumor, whether it's undifferentiated, well differentiated, and the family history of cancer, very important to ask the family history of a cancer patient. And then wherein you find that the tumor is kind of near a very vital organ, and you find that the immune system is compromised, the patient is not eating, the patient has a low mood, then in that way you start with a lower series of mistletoe and then you gradually rise it up. Many a times wherein you find that the tumor has got an intracranial or a spinal metastasis, then we do use radiotherapy, a few sittings to integrate and continue with the mistletoe therapy. So we do use an integrative approach at every stage.
Can you talk about how you choose what tree is you're using for what mistletoe you're choosing from which tree for which patient, what type of cases?
That's a very, very interesting question. It always comes up in the mistletoe seminars, Jenny. So basically, the selection of the tree depends upon the way the mistletoe injections are manufactured by the company. And basically, we use the three trees. The first one being the fir tree or the Helixor arbiatus, the A, mistletoe type A arbiatus. This has a certain lower component of lectins. Okay, pharmacologically, mistletoe extracts contain three main pharmaceutical components which act on different steps of the immune system. You have the lectins, which are glycoproteins, then you have the viscotoxins, and then you have the polysaccharides. Plus, you also have the alkaloids and the flavonoids, but we won't go into that either. So we start with the arbutus or the fir tree, which has a gentle immune optimizing effect in patients who are having a very, very weak immune system. So you start with the arbutus when the patients have received chemotherapy, immunotherapy, the counts are wavering, they are weak, low appetite, dehydrated, nutrition is not proper. And then you select the A arbutus, which has a gentle effect on the immune system. At no stage in cancer treatment do you want to overstimulate the immune system with mistletoe. We have to understand this fact. And for a gentle stimulation of the immune system, it is and always will be, according to European standard of care medical research that I'm involved in, is the subcutaneous route of mistletoe. Because the subcutaneous tissue contains many, many active immune competent cells, contains innate lymphoid cells, through which immune optimization happens. So then you select the arbutus, then you have a more stronger mistletoe, that is the Mali, and wherein you want the mistletoe to have a very potent immunological effect in younger patients, in aggressive tumors like sarcomas, you use the pine mistletoe. So that's how you decide between the A, the M, and the P.
Thank you. Let's talk a little bit about reactions. What if I don't get a reaction from the mistletoe injections?
Well, a lack of reaction, again, is the most frequent question that I'm asked. So it's due to many factors. It is due to a patient with a poor nutritional status. It's due to a patient who has received many, many aggressive therapies wherein the immune system is very, very weak to throw a reaction. It's also sometimes you don't see a reaction at all, but you judge the mistletoe action by understanding the other parameters of the general condition of the patient. How well do you feel after mistletoe therapy? So there are other factors also. Or when you have a lack of reaction, it's due to multiple supplements you are taking. So pulsing the supplements is a very, very important subject. Jenny, Joanna, and of course the other global medical advisors. We have a group of doctors over here who are working on a very interesting phenomena of pulsing the supplements. Many times when patients consult me online, they have been receiving so many supplements. My goodness, 10, 12, 14, 16 supplements. I really have to sit down with them and try and make them understand, to give it a break, to let the body respond. You see, medical treatment many a times at a holistic level, when you give a remedy, say you give a paracetamol, say you give a Tylenol, you have to wait for the body to respond, right? You have to give that much time for the body to respond. Herein, you are pumping in supplements, herbs and minerals and animal products, not allowing the body to respond, and vitamins also. So you have to give it some time for the body to respond. So many times I tell my patients to lay off all supplements, 2 to 3 weeks. They lay off all supplements and then we understand them again.
How soon do you give another dose, an injection, if you are still having a skin reaction?
We let the skin reaction, it has to be 5 centimeters or less. If the skin reaction is very strong, beyond 5 centimeters, staying for more than 2 to 3 days, then we wait for the skin reaction to settle down, 3 to 4 days. Again, understand the patient. Again, ask the question, how do you feel? How do you feel? And then we take it on. Or if you find the reaction is very strong, then we change the mistletoe type, or we change the company that manufactures the mistletoe.
So for someone that's not getting a reaction, at what point do you increase the dose?
If you're not getting a reaction, it requires a very detailed analysis. But if you are still maintaining your body weight, if you're still having a good general sense of well-being, then we continue with the same mistletoe type and we wait. And eventually they will give a reaction.
If
Sorry.
someone is no evidence of disease or in remission, the cancer is gone, are mistletoe injections or IVs still good as a proactive approach to reduce recurrence?
Absolutely. Absolutely. The main area wherein people come for mistletoe therapy is prophylaxis as a prevention. It has to be the subcutaneous route. Prophylaxis is mainly the subcutaneous route.
How soon or how long do we keep doing mistletoe if we have no evidence of disease?
Well, that depends on the individual patient, the type of tumor that they have developed, what quality of life, what is the balance in their life, mind, body, and spirit, if they are balanced, sleeping well. So normally in a patient with stage 1 and stage 2 disease, who's undergone conventional therapies, who is NAD for about 2 to 2.5 years, we give the mistletoe. But as you know, from the wheel that I showed in my practice, most of the patients that come to us are stage 3 and stage 4, wherein we continue mistletoe for 3, 4, as you've seen in the cases, for up to 4 to 5 years. We change the different mistletoe types, so it can be taken for a long time period as well.
Okay, just a few more questions, Dr. Zubin. And if your question has not been asked or answered yet, you are welcome to email him at the email provided in the chat and on screen. If you are asking a very specific, personalized medical question, that will need to be between him and you. Okay, so especially in America and a few other places in North America, we notice that mistletoe is often given in the same days or very closely with other IV therapies like IV vitamin C. Is that something that you do, or what is your protocol around other specific IV therapies like IVC?
Mistletoe is basically a very sensitive drug, a very sensitive remedy. From the philosophy, only you can understand. So I have made it a point, and I've mentioned this in many of my programs. When you give the mistletoe on that day, you do not give any other immuno-optimizing or immunostimulating remedy. So we don't give the IV vitamin C on the same day. You don't give a cocktail on the same day. When you give the mistletoe on that particular day, you have to give it only the mistletoe in a subcutaneous shot or an IV shot. And then you wait for a few days and then you give the IV vitamin C or the other therapies.
Okay, in your presentation, you mentioned there are 4 types of applications of mistletoe, and you've talked a lot about the sub-Q and the IVs. What are the other 2, and what would they be used for?
The intracavitary ones, when patients have pleural effusions, so we have the subacute and the IV, as you all know. Then you have the intracavitary, you instill the mistletoe in the pleural cavity for pleural effusion, peritoneal installation for ascites, and of course, now the latest use, which I have not been using up to now, is intratumoral, wherein you inject the mistletoe directly inside the tumor.
What about teas or using, people can buy the herb mistletoe and infuse it as a tea. Is that beneficial at all for cancer patients to drink mistletoe as a tea?
Well, mistletoe as a tea, yes, of course, it can be drunk, but most of the research based on the anthroposophical system of medicine in Europe is on the research on a subcutaneous and IV or the parenteral use of mistletoe therapy. There is no research on immune optimization through a mistletoe tea. Well, you can feel generally. A bit better in your symptoms, but on the immunological front, there is no research showing the mistletoe tea being immune stimulating.
Okay, 2 more questions and then we'll wrap up here. For people that use CTC, circulating tumor cell testing, that ends up taking your cells, replicating them, so to speak, and then testing various drugs and herbs like mistletoe, if they get back a result that says mistletoe is not effective based on that CTC type of test, Should they not pursue mistletoe therapy, or what's your take on that?
Oh, yes. Well, the main testing that people have been going around the world for knowing whether a certain drug is acting on the tumor cell, I do not agree to the point of that test. Firstly, Jenny and Joanna, that particular test, the blood sample is sent from one country over 8-10 hours to a different country, going to a laboratory in a different country. So the constituent nature of the chemicals in the blood has already changed. The blood has already altered its capacity. Number one. Number two, that test is done in a controlled environment in a laboratory, in a petri dish. It does not take into account the whole body immune response. And that is why I do not encourage my patients to send their blood samples to different labs around the world to get their testing to see which particular agent is acting or which particular agent is not acting.
Thank you so much for your comment on that. And then the final question, what are the key things that cancer thrivers should do for looking for a mistletoe therapy practitioner?
Well, primarily, as I've mentioned, mistletoe therapy has to be applied and has to be used by a certified practitioner who knows about the standard of care and European scientific guidelines on mistletoe therapy. So that is number one. Most of the naturopathic doctors are quite capable of giving mistletoe therapy, but in looking for a certified practitioner, you should look for understanding the European standard of care and safety guidelines.
Thank you so much. Okay, so Dr. Zubin Marolia is going to be live in person with us at the Annie Appleseed Conference the end of this February, and you can have a one-on-one in-person consult with him. You can do that through emailing him and setting up a specific time. Dr. Marolia, are you also going to be in Boston coming soon? Is that still happening?
Yes, Jenny. After the Annie Appleseed conference, I'm invited to share my experiences with the Leonard P. Zakim Center for Integrative Therapies and Healthy Living at Dana-Farber Cancer Institute in Boston. So after Appleseed, I proceed to Dana-Farber. From March 1st to March the 4th, I will be there. And then I take my long flight back to India.
Well, we're very thankful that you make the trek over here for all of us to be able to have a good time with you in Florida and Annie Appleseed. If you are not registered yet for Annie Appleseed, there are a few spots, a few spots left. So make sure to register today. You can register at annieappleseedproject.org/conference. And we do have a special discount code for you. Use code HEALTHY at checkout, and that'll be a special code for you. If you want to meet with Dr. Zubin, send him an email. And also, please connect with us on Instagram. We are at Annie Appleseed org on Instagram. And after this, we will have the replay available in the next couple of days that we will send to you via the email that you registered for. And with that, we'll also send a workshop survey that we would love your input on. It helps us know how to best serve you in the future with these various workshops. We are looking to doing more and more of these online workshops and would love your feedback on it. So look to your emails in the next few days for our post-workshop replay and survey. Thank you all so much for joining us and have a good rest of your day.
Thank you very much for inviting me. A warm bye to everyone.